Welcome, everyone. Thank you very much for joining us for today's live and interactive demo webinar, which will focus on WHO's brand new TB e-learning platform and available e-courses. In this webinar, we will be covering the following topics. So after the opening, we will move into a demonstration on how to access the e-learning platforms and how to navigate content in the e-learning courses. We will also hear back from course developers and learners about their learning experience. We will have Q&A sessions throughout the entire meeting using the Zoom Q&A function, which you can find at the bottom of your screen. So let me hand over the floor to the director of WHO's Global TB Program, Dr. Teresa Kasaeva, for opening remarks. Over to you, please.
Thank you very much, Karina. Dear colleagues, friends, partners, good morning, good afternoon, good evening. Warm greetings from the Global Tuberculosis Program from Geneva. I'm delighted to welcome you all to this NTB webinar, focused on WHO's brand new NTB e-learning platform and courses. The NTB e-learning platform brings together WHO-developed e-courses that aim to build strategic and operational knowledge to facilitate the implementation of the WHO's NTB strategy and provide the soonest uptake, the latest WHO guidelines on ending TB, amongst others. We are all driven by the intention to provide as soon as possible access to the best available options for the diagnostics, treatment, and care for all TB patients. And this new approach, we hope, gives excellent opportunity for this rapid uptake and for the capacity building amongst diverse groups and of end users in multiple countries all over the world. E-courses can be presently accessed via the NTB channel and in the Open WHO platform. E-courses on guidelines also feature in the TB knowledge sharing platform. More information and details will be shared later during the session. The number of e-courses will continuously grow and target multiple audiences, such as people providing guidance to stakeholders at the country level in developing and implementing the latest WHO guidelines and policy recommendations, healthcare workers working on TB, students, youth champions, and different physicians and experts working on the health field, not only on TB, but also beyond. And I invite you to keep a close eyes on the development in the NTB channel in Open WHO and the TB knowledge sharing platform. During today's hands-on demo webinar, a spotlight will be given to available courses aimed at facilitating uptake of the guidelines, as I've told. As we all know, unfortunately, in the when we can see the continued COVID-19 pandemic, and we see huge impact and reverses years of progress made in the fight against TB. This accelerating uptake of the latest WHO guidelines, policies, and tools is of a paramount importance. More specifically, we will focus on the e-courses today on TB preventive treatment, TB diagnostics, and TB drug-resistant TB treatment. These materials have been designed for people, as I told, who are closely involved in the care provision, in the decision-making, in the planning processes, and we hope that it could be useful for multiple purposes. Going forward, the intent is to ensure the availability of WHO-developed e-courses for all topic areas covered in the WHO consolidated guidelines on TB. Dear friends, before starting this event, I would like to thank the government of the Netherlands for their financial support that facilitated the creation of the NTB channel in Open WHO. The Dutch government was also the principal donor for the development of the aforementioned e-courses. And of course, I would like also to acknowledge our close partners and friends, the KNCV and its director, Gidado Mustafa, personally, for the close collaboration in development of these three courses. Colleagues, so now I am pleased to hand over the floor to Mr. Joris Jurens from the Ministry of Foreign Affairs, Netherlands, and after him to Dr. Gidado Mustafa, Director of KNCV.
Thank you very much, and good morning, afternoon, bonjour to everybody attending this webinar. I'm very happy to participate in this opening session on behalf of the Netherlands. As you mentioned, the WHO has been developing these three courses on webinar courses on TB in collaboration with KNCV and supported by my country. The Netherlands is a very active donor in the field of health in different areas and works closely together with WHO and other international health partners. COVID-19, of course, has been posing many challenges over the last 2 years. Also, when it concerns the fight against TB, but at the same time demonstrated very much the need for international collaboration in the field of health. Looking at the webinar and the learning courses, there's also important lessons to take from COVID-19. E-training platforms such as this can reach more people and allow practitioners in remote areas to update their knowledge and adapt to locally used products. I'm happy to see that there is such a strong interest in the e-learning program, as your Q1 data show. More than 10,000 people have been starting the different courses. It is positive that the NTB courses form part of the broader open WHO platform and form part of the integral learning portfolio of WHO. The development of the comprehensive training program forms part of a larger program on TB supported by my country. That also includes implementation research to refine short regime protection, the introduction of short regime for the treatment of latent TB infections, innovation in diagnostics and diagnostics tests specifically for children, and case studies to prepare the introduction of TB vaccines. I'm happy to see that the program we support generated so many positive results and as you mentioned, has a catalytic effect of broader impact. Be assured that the Netherlands continues to be an active supporter of the important work WHO is doing in the health sector and of other health partners fighting TB, such as the global funds. I wish you an excellent webinar this afternoon. Thank you very much.
Thank you very much. Over to you, Dr. Guirado Mustafa.
Thank you very much, Karine. And first, I would like to join Teresa in thanking the Dutch government for this opportunity, what I call a high impact intervention with a very global reach. As Joris just mentioned, the amount of individuals who has already benefited from this e-learning in the last few months. But I would also like to sincerely thank WHO team in general for giving KNCB the opportunity to collaborate in developing this e-learning platform. This e-learning platform surely complements and takes the WHO global policies and guidelines to what I call the finishing line, which is at the NTP level, healthcare workers, and for the use of all technical partners supporting TB programs in general. With KNCB years of experience in the field, we see major opportunities with this e-learning platform. One, as mentioned by Teresa and of course Joris, is that we are going to be able to overcome all the delays between the release of global policies and guidelines and their uptake in the field. Because NTPs and partners usually have to update or develop their new training guideline based on WHO advice. And that surely takes some time and takes some effort. But secondly, this also provides opportunity for standardization of training documents across countries, across partners, and across training institutions. As we are all aware, there are a number of training platforms for TB, with sometimes inadequate response or delay in the utilization of the new guidelines, especially at the country level where they are needed most. And I also see that this is part of the digital solution generally, where e-learning environment provide a rapid access to quality assured training package to a large number of participants in general, and therefore saving costs for the NTPs and partners generally in the support of TB globally. But it also provides opportunity for a very quick response in revising and updating these guidelines because they already exist in an electronic environment. Therefore, KNCB will sincerely encourage all NTPs and partners to facilitate the dissemination and utilization of this e-learning platform. And NTP should actually complement this training with quality supervision, as training, supervision, and provision of all appropriate tools are drivers of TB performance in general. They are not mutually exclusive and they should be implemented in a complementary manner. Once again, a very big congratulations to WHO for this fantastic initiative. And I would like to assure you of KNCB's support in the uptake, utilization, and provision of feedback on the utilization of this e-platform for the continuous improvement and development of newer modules. Thank you very much. And once again, congratulations.
Thank you very much, Dr. Guirado, for these opening remarks. So to facilitate sharing of information about the e-courses, WHO has developed for all three a short teaser as part of the promotional packages. And we just want to take a minute or two to share with you the information that is included in the teaser for the e-course on DRTB treatment. Thank you.
This course is important for you. Multi-drug resistant TB remains a public health crisis. Hundreds and thousands of people fall ill with drug-resistant TB every year. This course builds on information from the WHO Consolidated Guidelines on Drug-Resistant TB Treatment and is linked to the WHO Operational Handbook.
This e-learning course focuses on how to select appropriate regimens for treating drug-resistant TB in adults and children, and other subgroups based on a country's epidemiology, the patient's history, and the results of drug susceptibility testing.
This e-learning course was developed for individuals to provide guidance to countries on the uptake of WHO guidelines, such as national program managers and technical staff from ministries of health, WHO staff, staff of technical agencies, consultants, and anyone else supporting countries and major subnational units.
The content is presented using short video lectures, exercises, quizzes, and additional reading materials.
The e-course ends with a final assessment. When you achieve a score of 80% or higher, you can download a record of achievement.
Excellent, thank you. So the key take-home messages are that the content for the 3 e-courses that are presently available have been developed for a specific target audience in mind, and that these e-courses are definitely open to everybody. But given that there is a target audience in mind and that there is an assumption that these people have a certain familiarity with TB, these e-courses are not beginner level. The NTB channel in OpenWHO features all e-courses that WHO will be developing to facilitate the implementation of the NTB strategy. And in the TB knowledge sharing platform, you will find all e-courses that are focused on the guidelines. So let me take a moment and let's take stock of how many of us here today, we have over 145 people with us already, are familiar with the 2 platforms that I've just referred to. So let me hand over to my colleague Yi Wang for this. Yi, over to you.
Dear colleagues, friends, and all the participants, welcome to join us for today's demo webinar on the e-learning course training courses. I will take a few minutes to just walk you through and welcome you join us on the Slido question. So here through this screen that you can see, there is a QR code. I welcome you to use your mobile device to just scan this QR code and join us at Slido. If you are using a laptop, you could also type slido.com and by entering the passcode hash NTB to join us. So we will wait for several seconds to see how many people are joining us now. Once you enter into this interface, we can see, yes, you could join us to answer these questions. There is a question about which platform are you familiar with for this NTB training course. And also, my colleague Michael will put the link. If you are not familiar with the link, my colleague Michael will put the link in the chat for you to join us. So now we can see there are 50% of our participants are familiar with OpenWHO platform, and there will like around 32% of participants familiar with WHO TB knowledge sharing platform, and 9% of them of you are familiar with NTB channel in the OpenWHO platform. Then here we can see only 9%, or now it's 8% of participants are familiar with training catalog in the WHO TB knowledge sharing platform. So here we can see some like a quick survey. I'll hand over to Karina to go to the next session. Thank you.
Thanks, Yi. Excellent. So what this really shows is that it's worthwhile spending a little bit more time of sharing practical information of both of these platforms. So in the next session that is led by my colleague Lisbeth Oy, we will demonstrate on how to access and navigate both platforms, and we will give some practical information also about how to navigate content of the existing e-courses. Before Lisbeth starts, to all of us with us here today, this is supposed to be as interactive as possible. So please, as questions come up, please just post them directly into the Q&A Zoom function. We will go through them and make sure that after Lisbeth has provided her input, that we address and go through the questions that you have raised. So Lisbeth, over to you.
Thank you, Karina. Just before we start, I would like to reiterate the fact that we will be talking about two platforms, the NTB channel in OpenWHO, and this channel will host all TB courses developed by WHO and include the ones that we were talking about today, the 3 e-courses that focus on the uptake of guidelines. And the TB knowledge sharing platform is the second platform. And that platform, in the training catalog, you will only find those courses that are directly linked to specific guidelines and handbooks. So it will become clear once we go through it. And I will start with the TB knowledge sharing platform. So this is the homepage of the TB knowledge sharing platform. And you can see it's a sort of a one-stop shop where you can find the consolidated guidelines, the operational handbooks, and a training catalog. If you want to go to the training catalog, you simply click on the orange tile and you will go to the training catalog. And you can see which training are currently available. So we have 3 e-learning courses available linked to specific guidelines and handbook. If you are interested, say, in the rapid diagnostics test, the rapid diagnostics course, you simply click on this tile here and you will go to a page that will give you background information on the course. You can see here, it says something about the target audience, why you can take this course, and gives a brief description, the main topics, and it has a link to the related handbook and the guidelines. You will also find a direct link here to the e-course. So if I click here, I will go to OpenWHO. So this is OpenWHO, the course, and it has a similar setup for the background information. And from here, you can directly enroll in the course. You can also, maybe more easily, access the course directly going through OpenWHO. Let me show you. This is the homepage of the OpenWHO, and to have easy access to all TB courses, we've created a specific channel, the NTB channel. And you can find the channels here in the blue bar at the top. So if I go to the NTB channel, I will go to the NTB channel, as it is here. And here you can see the 3 courses. But in future, all other courses that are related to guidelines and handbook will feature here, but also other courses that are not directly linked to specific guidelines. And these courses may target also different audiences, like TB health workers, youth champions for TB, and of course, the target audience specific for these courses, the people that provide guidance to countries on the uptake of WHO guidelines. Now, if a tricky thing is that you need to register in OpenWHO if you want to be able to access a course directly. So here you see at the bottom, so we continue with the rapid diagnostics. You see, show the course details, so you get the background information, or you can enroll for this course. Now, if I want to do that, I need to have an account in OpenWHO. So let's see. I have an account, of course, but if you don't have it, you need to create an account here. It's a very simple procedure. But just in case, OpenWHO has created an instruction, and that link to that instruction will be shared in the chat. So I can easily enter here, give my password, and I'll go to the course. Now, I'll start with the introduction. This is the introduction module. You have a short introduction video. Here at the left side is the navigation panel. You can see the different sections. We are in section 1, it has the blue bar, and then you see the different sections here. If you want to move through the section, you can either use the images here on top. You can go from one to the next, or you can use the arrow here at the bottom. And if you move further, you will also see an arrow that will take you back. And so it's very easy, either on the left, top, or bottom are navigation options. Content is provided in using different formats. There are screens, there are video lectures, some exercises, a quiz, and I will go through them quickly one by one. Say we take this one. Each section starts with an introduction screen. In the screen, you get a quick summary of the content, the learning objectives, the topics for the session, and important, the essential self-study materials. So these are really the basics that we feel from WHO that you should read if you go through this section. At the end of each section, you will also find a list of additional self-study materials, and you can pick and choose from there, depending on your interest or your need. Then we have the video lectures. You can play them from this site. You can also decide to download them. Here at the bottom, you see several download options. You can download the complete video. You can download the presentation slides in PDF. You can also download the transcript, and you can download the audio only. So we try to cater for different possibilities for everyone. We have also the exercise, for instance. Let's see. Where is my exercise? Well, it's gone. The exercise has gone. I'm sorry. It should be here. No, it's not. No. Okay, well, an exercise usually looks like a screen, and it can have answer options. It also can have a download. And at the end of each section, there is a quiz. Now, the quiz is a simple self-test. You can take the test as often as you like, and it is meant to for you to assess if you have learned what you've learned in that section. So it focuses on the key messages, have you really understood them? And you can go through them several times if you like. At the end of the complete course, you can see it here under number 10, is a final assessment. And the final assessment is really the end of course test. And if you score 80% or more on that test, you can download a certificate. And I'll show you the certificate. It looks like this. It's not there. Why not? Let me try it again. Well, it has paused. Why is that? Resume. Well, I'm sorry. I'm not sure what's wrong. It says that my screen share has stopped, and I don't seem to be able to resume it. Yes, that was it. Thank you.
So thank you very much. So again, this certificate is available to learners that have successfully achieved an 80% score or higher from the completed e-courses. So thank you very much, Lisbeth, for this overview. And as Lisbeth has been speaking, there are a number of questions that have actually come through. And I suggest that before we move into the session, we take a few moments just to have a look at these. So we have one question from a speaker that is asking whether whether additional courses are expected to be produced in the near future. So Lisbeth, if I could pass that question over to you, please.
Yes, thank you. The answer is yes. The intention is to develop more courses, of course, for both platforms. And currently, we have work in progress for a course on systematic screening for TB, management of TB in children and adolescents, and a short course on TB and mental health. So it would be good to keep an eye on the platforms, and of course there will be a flash when they come out, but you could check also the platforms.
Okay, and we also have a question from, let me just quickly check, Eve Habimana Mukyo. We've given you speaking rights. Could you take the mic and the floor, please, and ask your question? So if not, I think in the meantime, then let me proceed by reading out the question that we had. So the question was, is the MDR-TB e-course content updated to include the new guidance given via the WHO rapid communication? So maybe here I can hand that question over to my colleague from WHO, Medea Gigia.
Okay, thank you for noting the recently released WHO rapid communication on DRTB. Indeed, this rapid communication is meant to sensitize and update the national TB programs and TB care providers on what to expect in the upcoming DRTB guidelines, and therefore it does not include any formal recommendation, but provides an information what to expect and how to plan their DRTB care in the nearest future. So the latest recommendation, updated based on the evidence reviewed by the guideline development group, will be featured in the DRTB guideline, which will be released later. And therefore, all these changes, as well as new or updated DRTB recommendations, will be incorporated only after we have the formally published guidelines on a WHO website. Thank you.
Thank you. So I think the important point to bear in mind here is that these e-courses and all new e-courses will always be updated as new guidance becomes available. We have an additional question here from somebody from the NTP in Togo, who is asking whether e-courses will become available in other languages. So maybe for this, I can turn over to Lisbeth. Lisbeth?
Yes, thank you. Very good question. Of course, depending on funding, but currently we are discussing translation of courses into French and Spanish.
Thank you. So perhaps one or two more questions before we move into the next session. We have a question on who can take the current e-courses? Lisbeth?
Yeah, thank you. I think this is an important question. In theory, everybody can access the platforms and everybody can do the courses. But you have to bear in mind that the courses were developed with a specific target audience and a level of experience in mind. So these courses are not beginner courses. These are courses for people that have more experience working in TB and could, in theory, provide assistance to countries, for instance, for updating guidelines or uptake of new guidelines. So again, everybody can do the course, but it's not a beginner course. It's advanced level. Thank you.
Thank you very much. So please don't hesitate to post more questions in the chat. The next session will also include a Q&A session. So we can then also make sure that we cover some of the additional questions that may come in at that point in time. Okay, so we will now move into the part of the webinar where we have an opportunity to hear back from course developers, but very importantly from learners who have taken the course from their learning experience. So how, what they have gotten out of the e-courses on TPT, on TB diagnostics, and on DRTB treatment. So I'm delighted to introduce my fellow speakers from WHO. For the TPT e-course, I have with me Dr. Avinash Kanchar. For the e-course on TB diagnostics, we have Charlie Nathanson. For the e-course on DRTB, we have Medea Gegia, and the TB regional advisor from the European region of WHO, Askar Yedibayev. And we also have Lisbeth Oy, who's you're now very familiar with, who is our education specialist. From the learners group, so to speak, for the TPT e-course, we have Savaiva Mungwambe. She's based in Mozambique. She works for the Arum Institute, and she's been leading the UNITAID-supported Impact for TB project, which supported the uptake of the 3HP project in Mozambique and has really been a pathfinding project that will catalyze countrywide rollout of 3HP in Mozambique going forward. We are also delighted to have with us Dikshit Kumar Kapadia, who is a medical officer from the Ministry of Health in Gujarat, India. Gujarat is one of the first states to scale up TPT and is one of the best performing in India. We have the e-course on for TB diagnostics. We have Siva Kumar, who is a scientist at the National Institute of Research in TB in Chennai, India, and the focal person for the Chennai Subnational TB Reference Laboratory. And Sunny Babatunde, who's a medical doctor and an executive director of the Optidel Global Public Health Consulting. He leads the team in the USA, South Africa, and Nigeria, and has wide consultancy experience doing mainly TB regional and national level projects in Africa, Asia, and North America. And for the DRTB e-course, we're also delighted to have with us Ignacio Monedero, who is a physician in Spain, a senior consultant on DRTB and TB HIV with a vast consulting experience across the world. So, dear panelists, thank you so much for your participation. This is really greatly appreciated. If your internet connection permits, I would really invite you to please switch on your cameras when you are speaking. And then, dear participants, do continue to use the Q&A function in Zoom. And I propose that we start with the questions on the e-course on TPT. So just as a bit of background information, this e-learning course aims to equip the learner with the necessary skills to facilitate programmatic scale-up of TB preventive treatment. So my first question is addressed to Savaiva and Dikshit. So what did you like best about this e-course? If you could please list 2 to 3 good things that you noted during the course and which you would recommend to future users, then that would be great. Over to you, Savaiva, please.
Hello, good afternoon. Hope you can hear me well.
Yes, we can hear you very well. We cannot see you, but we can hear you.
Oh, I'm sorry. Thank you. So for me, it was very interesting, the fact that, I mean, as Aurum, we went ahead and we initiated 3HP in Mozambique and other countries in Africa. And it could have been interesting for us if we could have had this opportunity to go ahead and do this course before we implemented 3HP. But nonetheless, it was very comprehensive for us. It cleared out some of the issues that we faced when we presented this opportunity to the Ministry of Health in Mozambique. And we figured out that this could have been an opportunity even for the Ministry of Health personnel to engage in and clarify certain issues before we went on and began the implementation process. So overall, we were very, very excited to have this new window of knowledge. Thank you. Thank you.
Thank you very much. Dikshit, over to you.
Thank you. First of all, my regards to all the participants from the land of Mahatma Gandhi ji and the Honorable Prime Minister Modi ji. Actually, I'm very thankful to WHO to give me the opportunity to participate in this webinar and also participate in the e-course. I am working in TB and comorbidity and national TB elimination program since 10 years, and I have gone through many of the courses, and this is my first experience to gone through the WHO e-course. And yeah, TB preventive therapy is a game changer in future. I mean, since many times we are struggling to control this disease, and now we have the regimen available, we have the diagnostic available. And before joining this course, the Gujarat state, particularly the Gujarat state, has statewide implemented TB preventive therapy guideline in the last World Health Day, that is 7th April. So, so in this course, I like the audio-visual presentation in this course very much, because it attracts the learner to participate in this course, and also the option of testing the knowledge, particularly the quiz options. So in quiz, we are about to know that where we are missing, also where the answer is wrong or answer is right. And even if you have the wrong answer, there are option of giving the right rational answer and justification is there. So I like that part of quiz is it is very good. I like that very much. And also the sequence of course is very good. I mean, it nicely designed in a manner that step-wise we learning of TPT is possible. So that from my side, and also I love to participate in more courses like Drtb and rapid diagnosis of tuberculosis. Thank you.
Thank you very much. So my next question goes to Avinash, as part of the team in course development. Avinash, is there anything else that you would like to highlight to today's audience about the e-course?
Yeah, thank you very much. I just wanted to re-emphasize some of the things that the learners highlighted and some that Lisbeth also covered. Just wanted to say again that since programmatic management of TPT is a new area. So this course really offers a window of knowledge, as Dikshit said, across the spectrum of activities that programs would need to plan and implement TPT at a large scale. Moreover, the course is very comprehensive, and it would equip anyone who takes this at a national level or a subnational level, and help in operational planning, as well as essentials that should be considered in budgeting for programmatic implementation of TPT. It follows a cascade of care approach, so the learner should find it easy to navigate the course and understand the nitty-gritties of programming. And then it's self-paced, so you don't have to complete the 7 hours course at one go. So you could take your time to understand the concepts clearly. And then for the beginners or uninitiated, it provides the rationale for programmatic implementation of TPT. It addresses all the questions or concerns that you may have for TPT in general. So I'll stop here and would be happy to answer if there are more questions around this course. Thank you.
Thanks a lot, Avinash. So I have one more question for Dikshit. From your perspective, does the course address the most frequent concerns expressed by implementers of TPT at facility level? And if so, could you please elaborate on the how? Thank you.
Yeah, surely. As I mentioned that the month back, the state has implemented the statewide launching of TB preventive therapy. So during the implemented time, I practically sharing you some queries, some questions raised by implementers and higher officials, because it is the new concept. So everyone wants to know the detail about it and all the pros and cons about this implementation of TB preventive therapy. So some question from the implementers, particularly the private practitioners and higher officials, that regarding the risk of development of drug resistance when we are giving the 3HP regimen and 6-month isoniazid therapy. Some the question that monotherapy can lead to the drug resistance or not, and some also have some concern regarding the feasibility and acceptability of TPT, because TPT we are giving to healthy people. So yeah, they have some queries that it is feasible, it is acceptable or not. Some ethical issue is there, and also some have the concern regarding the adverse drug reactions, and also some have concern about the diagnostics taste of TB preventive therapy. So there are many queries and questions raised during implementation time from our higher officials, and in this course all of the question has been addressed. So like in drug resistance TB, so if you totally rule out the tuberculosis by screening and by offering the test like chest X-ray and all, offering the TB infection test like IGRA and tuberculin sensitivity test, so that came to know that now the patient is not having TB, and if we can monitor the patient till to the completion of treatment, yeah, we can minimize or we can reduce the risk of drug resistance TB. Also, its long-lasting effect. I mean, it has the 60 to 90% protection when we are giving the TB preventive therapy. The second is risk-benefit ratio. So not giving TPT and giving TPT, that is very good mention in this course, that is individual, particularly with comorbidity and those have the immunocompromised status, they have the very much benefit of TPT. And TPT also given only to that infected patient, when currently we are seeing the Indian scenario, not all people required it. It required some high-risk population and those people living in that high-risk area that have exposed to TB. So yes, there are many concerns and queries raised by implemented, and in this e-course, it is very much, I learned very much that how we can tackle with it and how we can answer it. So thank you. Thank you. It's from my side.
Thanks a lot. Thank you. Very clear. So my next question on the TPT e-course goes to Survivor. Since you've been one of the early implementers of TPT using 3HP in Mozambique, what, in your opinion, regards the strengths or attributes of the WHO TPT e-learning course? It would be great if you could speak to that.
Yeah, I mean, in our case, we had already been using a different course of treatment for TPT, and some difficulties came up with that implementation. So the ability and the structure of the course to showcase how we could scale up this the TPT in the country and in any setting, in low income setting mostly, in a way that we would be able to begin with a really structured planning, and mostly for drug distribution, and making sure that our monitoring evaluation was happening according to plan, to what was planned, and avoiding the difficulties that we had in our previous regimes, made it actually showed this comprehensive content of the course, and it was very refreshing for us to find the clear way that we were able to absorb this information.
Thank you very much. So on the TPT e-course, I have one final set of questions to both speakers. Could you share, please, from your perspective on how this e-course can benefit future users on how to plan and disseminate it among the national and regional level program managers and supervisors in your setting? So maybe I start with Dikshit on this one. Thank you.
Yeah, sure. I think this course is highly beneficial to new and future users to get in-depth knowledge about global TB preventive guidelines and also the perspectives, and also to assess the local, national and subnational situation, and how with available resources they can implement TPT up to the grassroots level. So yeah, the knowledge gained from this course and the resource material provided in the course will be helpful to conduct the training at the state level, at the district level, and at the supervisor level to district staff, so and also general health staff. So so from my side, I mean, we can plan some physical training also by using this material provided in the course. Also online training, we can go to the downgrade training to the state and district level and sub-district level staff. Also particularly practitioner, and means we are organizing some seminars and workshops for private practitioner, and it is high time to share the TPT view to the private practitioner, because by implementing TPT, some many issues raised by private practitioners, particularly the patient goes to their clinic and they are in TB preventive therapy, they have some concerns about it. So it is very good to encourage the private practitioner, district officials, state officials to enroll into the course, get in-depth knowledge about TPT, get their queries and questions answered by this e-course. And this is how I mean the downgrade training can be done. And I would like to join. I am interested in epidemiology and infectious disease also. So I will also join the drug resistance TB and rapid diagnostic TB course in future also. So this is how I mean we have planned. Thank you.
Thank you very much. Survivor, could I ask you to please respond briefly to this question as well? Thank you.
Thank you. So personally, the demand creation opportunity seemed very interesting to me, and it is a priority at a national level and to every stakeholder that's working in the TB area, at the national level and at the level of ORUM, of the ORUM Institute. Regarding sharing this information, I mean, we have this opportunity, we had with COVID, this opportunity to go and have access to this online platform to work from. And just sharing this link with our TWGs and all the stakeholders that work in this area would actually open this opportunity to more people and make sure that we interact more regarding this subject in general regarding TPT. And we could, with the possibilities of the course, we could communicate and better our knowledge and improve our knowledge on this. Thank you. Thank you.
Thank you. Really appreciate it. So I think this goes to show that the materials that we have developed will help and can be used for further dissemination of information at country level. Let's now move to the e-course on TB diagnostics. So for the time being, this e-course focuses on two groups of tests. The first being the conventional and initial tests, and then the follow-on diagnostics tests, and elements and steps to consider when integrating these tests into an existing laboratory network. So my first question will go to Siva Kumar Shanmugam. From a learning perspective, what type of content did you find most helpful? Dr. Siva, over to you.
Thank you for that question. So first of all, I'd like to say that this is a very resourceful initiative by WHO as part of NTB strategy. And the e-courses which I took mainly on the rapid diagnosis of tuberculosis was lucid, and it was self-placed, so which makes it convenient for everybody to learn from the the courses rather than reading from the manual. And this will be really helpful for all the lab technicians to the clinicians who are treating tuberculosis. Now, what are the parts which I liked the most in the e-courses which I took was, first thing was the audio visuals. As you all know that audio visuals help better in learning process. In particular, in this courses, especially the performance of various tests was described very much in detail. Like, for example, Gene Expert was explained quite in detail. TrueNat was explained quite in detail, which is not used in certain countries as well. So the countries can take up those tests to perform the rapid diagnosis. Then LAMP TB also was explained really well. Now, apart from that, the course material which will be available, like slides, sets, and videos, can also be used to train the local, in-person trainings. This can be useful. Now, next thing which I liked the most was the quiz, mainly on the algorithms, which teaches you the algorithms of diagnostics in a better way than from any manual or books. And especially on the algorithms which are based on the sensitivity and specificity of a test and the prevalence of TB can be used for a particular country for designing their algorithms. So last but not the least, certificates definitely motivates people to take courses, and which will show that they have learned something rather than just reading books. I would like to suggest that even TB reports can be put in this format so that the uptake is more rather than a book. And apart from this, I have also I have told all the laboratories under us to take up this course so that they have a knowledge on this. And in my institute also, I have spread this courses saying that please take up the course, which is much lucid. Thank you.
Thank you very much for that. And on your last point, we're pleased to confirm that the Global TB Report exists in an app that is available in several languages. So thank you very much for that. So moving on to Sani Babatunde, could I please ask you, the diagnostics implementation and algorithms can be quite complex. So what I'd be really interested in hearing from you is how this course helped you to conceptualize these and use them in your work. Thank you.
Thank you very much for inviting me to participate as one of the external participants to pilot the WHO e-training course. This is a very novel and very important course indeed, especially to me as a consultant. And the course provided an easy to navigate, well illustrative training platform with a focused modular setting that made learning and understanding very easy. As a consultant involved in supporting the national TB programs, I must admit that the diagnostic implementation and algorithm can be quite complex. However, the case studies that were part of this e-learning process was a good way to consolidate understanding and develop a way of thinking that is aligned with evidence. The scenario deciding on the placement of different types of tests was really good. In addition, the clinical case studies with lung testing and different CD4 cutoffs helped to reinforce my understanding. My highlight is the model on the application of the 4 model diagnostic algorithms to different scenarios. It helped me to make easier the adaptation of algorithm to different settings, emphasizing the decision pathway. It illustrates steps to take in the implementation of new diagnostic tests and expanded on the key elements of diagnostic services. As a public health consultant, the course enhanced my practical understanding of diagnostic implementation and adaptation of algorithm to national context. I really recommend this to all consultants working in the TB space. And I'm really seeing this as a prerequisite for some of the consultancy work, maybe in Global Fund, Stop TB Partnership, even WHO and many other NTB partners. Thank you very much.
Thank you very much for your response. And just from the WHO side, we are delighted to be able to confirm that we will be, when working with consultants, making the completion of these courses mandatory for engagement of work with the WHO. So I would now like to turn to Charlie. Charlie, is there anything else that you would like to highlight about this e-course? Thank you.
Well, a lot has been said, so I won't be too long, but I would like to highlight that the course is really supposed to be a long-lasting course. So the core of this course won't change too much, except when guidelines and recommendations change. But we will update the course, and that will happen when we get new guidelines, as Lisbeth already has mentioned. And from a diagnostics point of view, we will have an update coming in probably late this year on TB infection tests. So look out for that one. Thanks.
Thank you very much for this complimentary information. So we now move to the third e-course, which is the e-course on DRTB treatment. So in this e-course, emphasis is placed on the implementation considerations for all oral DRTB treatment regimens with various duration, shorter and longer, including the different subgroups. So my first question goes to Ignacio Monedero. Please, could you respond to the following? What type of content did you find most useful for your work? And how did you actually approach completion of this e-course, given that this is a self-paced e-course? Over to you.
Well, thank you very much for the invitation. I'm a physician working in Spain, but most of my job have been working in the last 16 to 7 years in drug-resistant TB and TB/HIV in developing countries. And an important part of my job has been training people in clinical and programmatic management. So on a personal level, I have been always excited about the possibilities of self-learning, and not only in medicine, so then about electricity, plumbing, so why not a committed healthcare worker can definitely learn about drug-resistant TB online. So since a long time ago, I've been advocated for the open access of drug-resistant TB knowledge, right? Especially in countries where people where access to face-to-face or bedside training is difficult. So I've been involved in several of these trainings, but I really applaud this WHO initiative that really with other organizations like the unions and many others are making the state-of-the-art knowledge on drug-resistant TB much more open, democratic, and accessible to healthcare workers all around the world, no matter their country of origin or the level of income, just having willingness to learn and a basic internet connection. So going into your second question first, how long did it take me to take the course? Well, it took me a time, not really due to the course itself, but due to my working schedule and agenda, right? So I did it during 2 weeks, right, at my own pace. So in a way, I guess that other busy physicians or public health officers are going to take more or less this time. But for sure, young and motivated residents or nurses are going to do it much faster than me. Going into your first question, right, about the kind of content that I appreciate more. One of the things that I really like, it was like the training itself is like a quick access or a trampoline to self-study extra materials. So in one side, you have many other relevant documents and services in a way that if you want to get really in-depth trained, you can do it. So you can go jumping from one content to another, and the training is really doing so. Another second thing that I found particularly useful is that the training do not cover only the recommendations or the guidelines itself, but also include the special situations which are critical in drug-resistant TB, like, for example, the use of off-label bedaquiline or delamine management in complicated cases like children or pregnant women or people with restricted and resistant patterns and toxicities. So the point is that usually physicians or public health officers go to the guidelines as a reference, right? What to do in complex situations. And the very good thing of this training is that the training covers this kind of special situations that goes out of the normal. So there are practical examples, that is something that I really appreciated. For example, how to switch between the different regimens, and practical tips, not only from a public health perspective, but also from a clinical monitoring issue. Finally, another issue that I appreciate from this training is related to the daily life context and circumstances that usually guidelines do not cover. I'm talking precisely about the patient support, which is something basic, like in order to increase adherence. So in the training, there were very basic and extraordinarily important things like how to approach, how to talk to patients. This is something that usually it's overlooked from guidance and also from other trainings. So in a real life, these kind of things based on build trust with the patient, and is the key to adherence, and adherence is the key to cure in extraordinarily lengthy and complex situations. So there are many other tricks included and advices on how to make the management much more patient-centered. So I really applaud this initiative and thank you very much.
Thank you very much for this very comprehensive response. So my next question goes to Askar from the WHO Regional Office for Euro. Askar, the DRTB course is comprehensive self-paced learning material. How, from your WHO regional perspective, do you think this e-course will help countries in accelerating the implementation of the DRTB treatment policy? Askar, over to you.
Thank you very much for Karina, and thank you very much, dear colleagues at the Global TB Program, for inviting to this meeting. So I would say that this DRTB e-course is something that we have been requiring for long and waiting. So I would say that again, this will help to accelerate the uptake of the implementation, the uptake and the implementation of the latest WHO policy guidance on treatment of drug-resistant tuberculosis. And that is exactly what is presented in the highlighted in the treatment guidelines. So what I would say is that the structure of this course, it follows the operational handbook on treatment of drug-resistant TB. And in addition, it provides quizzes and multiple choice questionnaires under each of the chapter, which is very much convenient and very good in terms of the uptake of the guidelines. So, and I would say that this specific e-course is highly relevant for high burden settings and countries for drug-resistant tuberculosis, especially for the WHO European region, because which I'm representing here, and our region is a home for almost a quarter of the global burden of multi-drug resistant tuberculosis and 47% of cases globally of the MDR-TB and additional resistance to fluoroquinolones pre-XDR. So it is important also to note that advancing towards the transition to the fully oral treatment regimens for drug-resistant TB under programmatic and operational research condition is happening, and it's happening very fast, and our WHO European region is well advanced on that. But nevertheless, despite the fact at what stage we are, this e-learning course is quite relevant and important. And this course can be used as a wide array, can be used by the wide array of participants with different backgrounds, and keep them all updated about these latest recommendations. And the audience that this course is recommended is wide, from the NTP managers to health providers, clinicians who are treating patients, everyone who is involved in a daily, everyday treatment of patients with multi-drug resistant tuberculosis. For the, I would say for the NTP managers at the central level or at the oblast or regional levels, or officers at the ministries of health involved in tuberculosis response, this course might be also considered as relevant and interesting and important from the view of supporting further the transition to fully oral treatment of drug-resistant TB that is being recommended by the WHO for quite a while already. But also it is important for them to be supportive in eliminating barriers to procurement and availability and access to the new tuberculosis medications that are being recommended by the WHO, and given an understanding to allocate sustainable and sufficient funding for the to support this transition to the fully oral treatment regimens, and supporting the updates on a regular basis of their national guidelines, and especially for treatment of drug-resistant TB, if we're talking about this specific course. So, and the quality of the recommendations by the WHO is out of questions. Of course, the recommendations are well justified and based on the quality evidence. So from the clinician standpoint and people who are involved in the daily treatment of patients with multi-drug resistant TB, the virtual and self-paced nature of the course and the flexibility with access will help more people using and learning from this course to benefit from that, especially for those clinicians who are based in the remote areas, and that is also so typical for some of the countries of the WHO European region. Further, as travel may not always be possible due to the ongoing pandemic, and therefore the e-course provides an additional option for to physical training. And the beauty of this e-course is that the practitioners, they don't have to wait for the courses that are organized in person or in another format that we have on the uptake. So this course is providing this opportunity. From the clinical perspective, it's very important to know that this course is offering that and better understanding of how to select the appropriate treatment regimens for drug-resistant TB, shorter regimen or longer regimen for eligible patient group, taking into considerations the need of various subgroups to the country context, epidemiological background, patient history, and results of drug susceptibility testing. And also this course is explaining the implementation or operationalization considerations for different treatment regimens for eligible patient groups. describing the adjunctive treatment options, possibilities, and of course, the importance of the active drug safety management and monitoring. So in overall, I would say that the module is intended to shorten the duration between the release of the recommendations, of the new recommendations, and the uptake. And at the same time, the course is a new opportunity of capacity building, is also contributing to the good clinical care of patients on treatment. Of course, this specific e-learning course is based on the guidelines and operational handbook that was released in the summer of 2020. But recently, and it has been raised already by by some of the colleagues in the question chat, that the WHO hosted the guideline development group on treatment of drug-resistant TB, and just this Monday released the rapid communication on key changes to treatment of drug-resistant TB. And there are several key updates on the use specifically of the novel 6-month treatment regimens for drug-resistant tuberculosis. So what we need is, of course, the dynamic update of the online course once the new guidelines will be released. So we expect that the new guidelines, based on the latest guideline development group, will be released before the end of this year. So, and I would say on behalf not only of the regional office, but also from the colleagues in country office, and maybe on behalf of the colleagues at HQ, that everything to be done is in the release of the recommendations and in this course is done in the best intention to rapidly uptake the new guidelines, and that patients benefit from the latest recommendations. So I would just like give my best applause to the group at the WHO headquarters who led the developments of this process, and everyone who been part of that. Thank you.
Thanks a lot, Askar. I appreciate it. So Medea, also from the course developer's perspective, what are the elements that you would like to see highlighted?
Yeah, thank you, Karina. I think most of this has been said by the panelists. Thank you very much. But I would be adding a few highlights, a few advantages of the existing DRTB course. First of all, because it's a learner-centered in terms of content, and readings and quizzes at the end of each chapter enables the learner to apply the knowledge gained through the course immediately. And I think this is one of the biggest advantages of having this course. Content-wise, it also balances the WHO policy guidelines as well as its derived documents such as operational handbook. However, by using different learning methods such as case studies, multiple choice questionnaires, it also gives the learners confidence to overcome the real life situation that they may face while treating DRTB patients. So as a course follows the content of the WHO operational handbook, it indeed provides a detailed information that is coupled with the examples on how to choose the adequate treatment regimen, how to prioritize all oral regimens, and also explains the eligibility criteria for each of them, but in a way that it justifies the selection of the adequate DRTB all oral regimen, and also takes into consideration the country's epidemiological situation. And lastly, by its content and by presenting a few challenging case studies that are included in the DRTB training course, it makes a learner to think and stimulate decisions thoughtfully. And I think, in my opinion, it also positively impacts the learners' on-job performance that are so much needed while treating TB patients. So I'll stop here and happy to answer any questions. Thank you.
Thanks a lot, Medea. So I think we've now completed the first round of information about the 3 e-courses that are available. And as speakers have been making their interventions, there's been a lot of engagement in the Q&A chat. So we will now move into the Q&A session. And one of the first points that we would like to discuss in a little bit more detail is the question as to whether these e-course content can be used for in-country training. There are numerous people amongst the audience that have expressed this as a question. So, Lisbeth, over to you.
Yeah, thank you. It's indeed a question that comes up quite often. And in principle, you can use the courses for in-country training. However, it is very important that you keep in mind for who these courses were developed. The courses are developed for a higher level cadre of people that can guide countries in developing guidelines and implementing guidelines. So if you are thinking of using these e-courses or parts of e-courses, say for health facility level, you may have to do some work because the courses do not specifically go into country situations. It is, as mentioned before, really based on the handbook that accompanies the guidelines. So please feel free to use the materials, the videos, everything you can use as you like, but keep in mind the target audience for which these courses were developed. Thank you.
Thank you. So thanks for highlighting this and the programmatic focus of the e-courses. So I would also like to give the floor to Emmanuel Olashore. Please, could you take the floor to ask your question live? Emmanuel, I'd be grateful if you could take the mic. We've promoted you to panelist, Emmanuel, so please feel free to share your question. Otherwise, I'll read it out. Okay, so the question is, in some cases, some countries lack the technical and material capacities to implement some sections of the TB guidelines on which these training materials are based. How do you intend to manage these concerns, especially amongst participants who are healthcare providers who may have little knowledge of their local TB control program, thereby leading to consistent TB program implementation within the country? Could I turn to my colleagues for this? Avinash, do you want to start with a response?
So, if I got the question right, so is it Karina? Please confirm. So it's about local capacities and local if the local guidelines are not updated along with the global guidelines, and how do we manage this? So what I would say is the courses are based on the latest WHO guidance. So you won't be wrong if you implement those guidance. But in case, but in principle, the implementation at the local level should be guided by the national guidelines, and we should use these learnings from these modules to advocate for update of the national guidelines if they are not yet updated.
Thank you. Medea, Charlie, do you want to add?
Yes, I can add just emphasize what Avinash just said, that if it must be the country's the level of implementation in the country that steer what is used as training courses. So the training courses won't change policy in countries. That must be the sort of focus. We cannot change policy in countries through these training courses.
Yes, but what they will help is explaining the rationale for change. So that is very important, I think, to consider. Medea?
Yeah, I think I will reemphasize what was just mentioned. The question is about the content, and content-wise, of course, the existing DRTB courses, as well as the others, are solely based on the latest WHO guidances, and even more, it goes beyond the guideline and also includes a real life situation, which enables the learner to overcome the challenges that they may face. So therefore, it's a useful tool to increase the capacity at the local level. But indeed, having the local guidelines is equally important.
Thanks a lot. So we hope, Emmanuel, that has helped to address and respond to your question. I can see also that we have recurring questions about whether or not these courses will be updated. So I think I will again just hand over to Lisbeth on that one.
Yes, thank you. Yeah, the courses will be updated when there's new guidance being released. So that means that we move with the updates of guidelines and handbooks.
Okay, I can see that we also have Sadiqia Sapkota. I apologize if I mispronounce. Would you like to take the floor to ask your question?
Hello everyone, I am Sadiqia Sapkota, President of National Youth Movement Against Tuberculosis, Nepal. Thank you for giving me this opportunity to put on my queries. So my questions are, how can young medical professionals and public health students be benefited from e-learning platform? And other question is, how this e-learning platform does this e-learning platform have any course targeted to young people like us? And if not, is there any plan to develop courses as such, focusing young TB advocates? That's all, thank you.
So thank you. So maybe we can start with the second part of your question, which is a really good one. So the answer is yes. I believe there is an e-course under development that will target youth champions. And as we mentioned, the overall portfolio of e-courses on TB is going to expand. So, for instance, in 2020, in 2022, we are presently working on e-courses on TB screening. We are working on an e-course on TB in children and adolescents, on TB and mental health, and various others. And that is, I think, why it is so important for all of us to continue watching this space. And as we mentioned, these e-courses that we are developing, there will also be e-courses for other target audiences. So not only for people who are engaged in programmatic decision making, but also for healthcare workers, also for youth. So especially, you know, for people at facility level working on TB. So do keep an eye out on it. If you're really interested in just the guidelines, then there is the one-stop shop of the TB knowledge sharing platform. If you're interested for e-courses above and beyond that, including the guidelines, then your one-stop shop is the NTB channel in OpenWHO. And let me hand over to Lisbeth for the first part of your question. Lisbeth.
Thank you. Yeah. The question was if young people and students can benefit from the platform. I think at the moment, when we look at the people that take the courses, there's a variety of different audiences, and there are among them is quite a large part students. So apparently they find their way into OpenWHO, the NTB's channel, and do the courses. Again, the courses are not specifically designed for students, but of course they're free to take them as they want. And as Karina said, we are building the platform. So in future, there may be other courses that are more suitable. But before that, it is, of course, everybody's free to take the course. Thank you.
Thank you. And if you allow me to add on to that, I think what is interesting about these e-courses is that it contextualizes, right, the importance of these three thematic areas that we've covered today. So I think even if these e-courses are not totally tailored to the needs of students and medical students, they will give you very important information as to why it is important to scale up TPT, for example. How is it linked to the efforts and global targets and the overall strive at country, regional, and global level to end TB? So I've seen that there's also a number of questions still coming through about the languages, and we very much appreciate that there is this desire to see these e-courses translated as quickly as possible. So let me just be really clear and say that for this year, we will be prioritizing the translation of the TPT and the TB diagnostics e-course into French and Spanish. Thank you. So this is an opportunity for our audience, as we are coming close to wrap up, to please raise your hands if you have another pressing question that you would like to see us address in this forum. So maybe I'll just give a couple of minutes to see if anybody has any questions, or a little moment. Emmanuel, you have your hand up. Please take the floor.
Okay, good afternoon. It's a great pleasure to participate in this session to get to understand about the e-learning platform. I want to really get a full understanding of the response to the question on the guideline, the alignment of the WHO guideline with the country-specific guideline. In some instances, it is possible that the country may not have the technical or material capacities to implement. I think it will be good to have maybe recommendation or caveats for learners because the wide range of healthcare providers, particularly in the private sector, who may take up such training and start implementing contrary to what is existing within the country and try in such create a parallel implementation of the TB program. My comment. Thank you.
So thank you very much. So I'll hand over to Avinash for this question, please. Thank you. Avinash, over to you.
Yeah, thank you very much for the question. And as I mentioned before, the courses provide with the latest WHO guidelines, and I understand there would be difficulties in implementing all the recommendations at the country level. So I mean, there are two ways we can think around this. One is to advocate with the country officials to update the guidance, and two, if you are equipped with the latest guidance that and if you implement some of it, it won't be wrong in any case. So it's more to enhance the knowledge about the latest guidance, but also as a tool to advocate with your officials and with the donors as well to invest in some of the latest recommendations. Over.
Thank you very much. And I also would like to just, recall a little bit about what Dr. Teresa Kasayeva, the director of the Global TB Program, mentioned in her opening remarks. And that is, the COVID-19 pandemic has reversed years of progress in the fight against TB. So accelerating the uptake of the latest WHO guidelines and tools is of paramount importance to get us back on track and also to meet the high-level global commitments that have been made by national leaders in the response to end TB. We have the UN high-level meeting in 2023, where we will need to be in a position to report on the achievements of targets made by heads of state. So thank you very much. So I think I can see no additional hands up. So perhaps this is the time to thank you all for your participation and active engagement in the Q&A Zoom chat. We really hope that you found this event useful and that it has helped you to gain a better understanding about the TB e-learning platforms that have become available and given you a better understanding sense of what is already there and the fact that more will be coming. So sincere thanks to all of you here in Geneva and across the world, and wishing you an excellent continuation of the day. Thank you very, very much. Take care.